Welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb, and today we're continuing our conversations about orgasm.
I guess it's our biggest series.
Well, there's just so much to talk about, so much information that is not out there that people have questions about, or they're afraid of, they don't have good communication skills with their partner, they haven't been taught by our culture, our system. Sex education is such a challenging and laden topic for families, for schools, for churches. For instance, one of the questions that sometimes is asked, or when it comes up in discussion, the responses are sort of shocked concern, is the question, do women ejaculate?
I know, everybody goes, oh, don't think we're going to talk about that.
Yeah.
But, you know, interestingly enough,
it's a man thing.
Interestingly enough, it's not. In fact, women have two ways to ejaculate. Men can only do it one way. So there are two processes that the body goes through, and every woman has the capability of doing this.
Okay.
You have to have the proper hormones, you have to have the proper partner, but women can ejaculate from two tiny little glands next to the urethra. They're on either side of the exit for the bladder, and they're called the Skene's glands. And they can actually propel clear fluid, which is not urine. It's been tested, which is definitely not urine. And they can propel it several inches and at the time of orgasm. So that's one type of, there are lots of diminutive terms for that, which I won't mention, but but it is female ejaculation. But the other form, which is not as often discussed, is a ejaculation from the vagina, from stimulation of the vaginal wall, and it can be stimulation of the cervix, but it's more of a milky, thicker fluid, and it comes from the very top of the vagina, and it can be a large volume, and so everybody says, well, where did that come from? I mean, there's nothing up there. The uterus does not make it. The cervix does not make it. The vaginal wall actually, believe it or not, acts like a sieve, but a sieve that actually pushes the fluid that's in your abdomen. You have some fluid around your intestines called peritoneal fluid. It actually pushes it through the vaginal wall with the nitric acid, you know, that you get when you have an orgasm. So you have nitric acid from all the nerves in your pelvis. This fluid goes into the vagina and then flows out. And it can be a lot. It can be cups worth, according to Dr. Whipple. So this is a different thing to discuss. People don't think that it's normal. Women are often embarrassed. And why are you looking so surprised?
Because I didn't know all of this, and I would have considered myself reasonably informed.
You are.
This is fascinating. I'm not surprised as much as fascinated.
Well, I bet you didn't know that on this challenge, I bet you didn't know that men's semen actually has an effect on women because it contains testosterone, estrogen, prolactin, LH, FSH, all the hormones women need. It stimulates their entire system, and it is absorbed within the hour after intercourse. So the hormones. So the hormones in that man
in the semen
are produced,
absorbed in the woman's vagina.
Right.
And
they go into her bloodstream. It's vaginal absorption. It's very fast.
And so what does that do then for her? Is it similar to the hormones her own system makes? I mean,
it's similar to that, but it gives her kind of a rush of testosterone and a rush of the other hormones. Okay. So it is part of that post-sexual feeling Euphoria that you don't get if you're using condoms. And you don't get often if your partner's had a VAS. Not always, because some of it's from vasectomy. Some of it's from prostatic fluid, and prostatic fluid is still produced if you've had a vasectomy. But some men don't produce as much, and some of the volume doesn't come through. So it is a decrease with a vasectomy. But in any case, we also can absorb prostaglandins, and prostaglandins are what make women cramp during their period, but it's also in semen, and that is what makes women cramp after intercourse if the man makes a lot of prostaglandin. So
I did not know this. You're absolutely right. I'm abysmally ignorant about these things.
So we're getting an infusion, basically, from our partner. So
a hormone infusion.
A hormone infusion, and it's
if you're not using a condom.
Right, right. So, I mean, that is no justification for not using a condom. I don't want to say that because I don't want people to say, I suggested that they not have safe sex.
Right.
I'm just talking about people who are in a monogamous relationship. That means more than a week. Monogamous means like you're married. I mean, I have kids used to come in and say, yeah, I'm in a monogamous relationship.
Teenagers today practice serial monogamy.
Like every other week they change partners.
They change partners, but then they're
not
true
what
to
I'm
the new one. Yeah.
Talking about.
Yeah.
I'm talking about monogamy, like there's no one else involved in the relationship outside, and so you have two people who are not going to be infecting each other with diseases
not to be indelicate,
causing.
But a female who has an orgasm as a result of masturbation does not receive the infusion of hormones from the semen. Does she then therefore have a less satisfying orgasm? She doesn't have the same post-euphoric experience.
You'd have to ask her. That wasn't in the studies. I can't tell you that.
Okay.
And I've never asked a patient that.
And how would she know anyway, unless she was carefully aware and measuring? Okay. So
there's, I mean, that would be something that might be kind of subliminal, that you wouldn't know exactly.
I would think it would be similar to having sex with a condom, in that you don't get the hormonal payoff.
Sure.
But there still are payoffs that make it worthwhile enough that people do it.
No, there's still payoffs, and the payoffs we talked about in the beginning have nothing to do with semen.
Okay.
They don't require semen. The payoffs from stimulation of the areas still go to the brain and still create an orgasm. And in general, the reaction of the woman after an orgasm has to do with, generally she has contractions of either the uterus or the vagina or both. And after hysterectomy, you have phantom uterus kind of feelings. You don't feel different if you have your cervix.
So I'm coming up with another question here. Can you tell?
Yeah. The questions that all the men out there want to know.
A complaint that I frequently hear is that post-coitally, men fall asleep. 30 seconds, boom, they're out.
Prolactin.
But women have this suffused glow and want to cuddle and be close and remember and all. Is that related to the hormone infusion? Is that related to the intensity of the orgasm? Is that social? I mean, do you know?
I don't know for every woman. I don't know why that would be for every woman. I think everyone's a little different.
Well, it's also not true that every man falls asleep immediately either.
No,
I mean,
but those are cultural. Their brains just created fireworks.
Yeah.
So their brains are stimulated. And the same thing can happen in men, but they have a different reaction. That's why, the difference, we can have the same hormone in a man and a woman, and it does something different.
Okay.
Like prolactin. Prolactin is the hormone that occurs after intercourse and after orgasm. But in men, it prevents them from having another orgasm, and in women, it stimulates the possibility of having another orgasm. So they can go on, and we can go on and have orgasms if we train well, train for the marathon orgasm.
Yeah.
And we can have many orgasms, and that's not unusual. In fact, one of my patients says she got dehydrated from having so many orgasms because she also ejaculated.
Going back to the ejaculation and the fluid loss. Yeah.
So but because men and women both have orgasms, it doesn't work the same in their brain.
Right.
So in that way, I don't think it has much to do with the infusion. I never asked.
Yeah. No, and it's probably not a particularly apt question. It's just one that occurred to me.
So, and in one, I mean, the multiple orgasm question, I can tell you I have enough people that have told me that they have them, that it's real. I mean, because I was on a trip to Kansas City. We have an office there, and a lot of my employees were with me. And the employees are nurses and medical assistants, and they were sure it was a lie. They were positive. And I've had enough people tell me the story in the same way that I know that it's got to be true.
Well, and Dr. Whipple's research.
And her research says it's true. I mean, you have to have science, and you have to have...
she has CAT scans to prove it.
Yeah, she does.
Yeah.
So,
but there are women who are what are called anorgasmic.
Sadly, that's true.
And the single most common cause for anorgasmia in women is too low a level of testosterone.
That's right. I mean, the one thing that's common with all of these women is to have an orgasm, you need to have testosterone because both chemically and neurologically, you need it to provide you with the right chemicals in the nerves and the right stimulation and the blood flow to the pelvis. Otherwise, you're not going to have it. And so you have to have testosterone. And there are many women, you know, the range of testosterone levels in women throughout their life are all different.
Right.
There are some families that I see all the sisters, and they say none of us ever had a sex drive. I mean, we got married, but we don't care. And their levels are really low.
Right.
And so when I treat them, they're like, whoa, wait a minute, this is awesome.
Yeah.
And they become orgasmic after years of not becoming being orgasmic.
They become
Within the
orgasmic
same
when the
relationship.
testosterone is provided
Right.
at a sufficient level.
Right.
Okay. Now, there are other reasons why women might be anorgasmic.
There's many reasons why women might be anorgasmic. It's amazing that we...
With enough testosterone.
Yeah,
I mean,
even
there are
with
other,
enough testosterone.
And one example of that would be a woman that's on antidepressants.
Right.
Because antidepressants restrict or inhibit the libido and can cause, even in the middle of a sex act, can cause the system to just turn off. And suddenly, I mean, they go from being passionately involved to completely not involved in terms of physical responsiveness. And that leads to relational problems. If they don't know this, if they don't know this can happen if you're on this medicine, and have some encouragement to talk to each other about when it happens, how do you understand it, how do you feel, what else needs to be done,
Well, it's very
can we start over? Oh my God, yeah.
For the woman to get
and for the man that's with her.
Right, yeah, that's true. I didn't really think like that, but
That's because you're a woman.
That's right. She gets to this certain point and it's gone.
Yeah.
And that's partially because of serotonin's relationship. Serotonin is what antidepressants create.
It can also happen to the man
and dopamine.
if he's on the antidepressant.
Right, it can happen to both.
Can happen.
And they have the same neurotransmitters, but the serotonin, if the serotonin is high, then dopamine's low.
Yes.
If serotonin is medium and dopamine's here, then they're fine. But if right after orgasm, the dopamine should go up, but the serotonin's shutting it down. And that's one of the neurotransmitters that gives you the pleasure of orgasm. You can't get there without having dopamine. And so if you're suppressed because of your antidepressant, that causes you to be not depressed anymore because serotonin makes your mood better, but you're not going to necessarily have a good sex life. So you have to choose depression versus a good sex life.
You were also saying in addition to antidepressants, there was another class of meds. Was it antihistamines?
It's antihistamines. There are two classes, antihistamines and antihypertensives.
Okay.
Low blood pressure medicine.
Right.
They
I knew the low blood. I didn't know
they
the
both
antihistamines.
decrease the blood flow to the pelvis because testosterone allows nitric acid to, nitric oxide to open up and dilate all of the blood vessels. And when you take those medications, they fight the dilation of the blood vessels. So they just keep the blood pressure and the pulse even.
So I've read that a lot of men who are prescribed and begin to use ED drugs like Viagra or Cialis often stop using them within a couple of months because they can get an erection, but their sexual experience is just not that satisfying. And I'm wondering if there's a connection here in terms of the restriction of fluids to the vagina, I mean, to the penis, to the abdomen. Do you know a medical connection for that?
Well, Viagra works by vasodilating. All of the anti-ED drugs or the ED drugs cause vasodilation in the pelvis. That's how they bring on an erection. Okay, so they bring blood flow there. Now,
but if the testosterone is not there,
if it's not there, then they're not going to be satisfied with just an erection because they aren't going to have the libido. They're not going to have everything else that goes along with it.
So they're not going to get the release of the full experience. They
Some
may
do,
just get,
but most don't.
Okay, and so that's one of the reasons then why you would consider why did they start it and come off of it?
Right, and why are men anorgasmic? That's one of the reasons. I mean, they can, with help with the medication, you can get the erection. You can't necessarily get the ejaculation or the release or the orgasm.
Because the chemical switch never throws. They hover just outside the range,
and that's
the
very
chemical
frustrating.
release is never completed. So then they just give up and say,
Well, while we're on that,
Yeah.
there's one other thing that most men don't know, because you can have testosterone, you can take Viagra for blood flow, and you can still not get an erection. And that's because you're stimulating blood flow to an area that is dependent on the blood vessels in that area. If your blood vessels are covered with plaque, if you are not getting blood flow to your pelvis so that you can have an erection, then no amount of testosterone and Viagra is going to get there.
Yeah.
It's just not going to get the blood to the area you need the blood in.
It's also possible, and I want to make this point as well, it's also possible for men to have very satisfying sexual experiences without having an orgasm.
Right.
If they understand and frame sexual encounters as part of intimacy and part of connectivity, as opposed to framing it in terms of orgasmic release.
Right.
So some of it is in the anticipatory set, as educators would say, how you frame what it is you're trying to accomplish or what it is you're trying to achieve. I mean, orgasms are wonderful and nice and satisfying for men and women. We all want to have them, but sometimes that's not what it's about.
Right. That's right. And that's what makes the intimacy of couples so complex.
Yes.
So, but not every man is going to feel that way. And usually they're not going to feel that way as young men, because that's kind of, they're pushed
Exactly.
to ejaculation. As they get older, they may be more accepting of a different paradigm. And we see that all the time. But I just don't want anyone to leave the podcast thinking that, oh, testosterone, Viagra, I'm fine.
Yes.
You know, the diabetes is a perfect example. All the tiny little vessels, they just die.
So it's like neuropathy.
Only no vasculature.
Except vascular.
And they also have a neuropathy issue, but usually the vascular problem is first.
Okay.
And so they may not have coronary artery disease or
So
atherosclerosis.
then the treatment for that would be to treat the diabetes?
Treatment for that is very difficult.
Yeah.
If you've gone that far in diabetes, then both men and women have trouble having orgasms or having even stimulation, kind of a response to stimulation.
So the message is, if you want to have great sex and fabulous orgasms, stay away from diabetes,
Lose weight,
especially type 2 diabetes.
Stop eating sugar, and try to get your weight down so you don't have diabetes anymore, because it's long-term damage to your vessels and your nerves that cause that.
And it may not, if you go too far, it's not recoverable.
Right. And sadly, nobody's figured out a way to get around that.
Yeah.
But anorgasmia is not just a physical issue. Sometimes anorgasmia has a lot to do with the psychology of the patient, of the woman, and guilt is the biggest issue. Lots of women don't think they deserve to have an orgasm. They don't think it's feminine. They don't think it is, because they lose control. If you don't trust your partner, then you're not able to lose control in front of them. If your hair has to always be perfect, then it's very hard to have an orgasm, because you're not going to be able to be in perfectly coiffed and have your face in the perfect position when you're having an orgasm. It's just not going to happen. So there's so many things about our personalities that can throw roadblocks in front of us to prevent us from having orgasms. And then, of course, I don't want to go into this necessarily so much, as our listeners aren't usually as interested in this, but when children are sexually abused, then it's often the fact that they cannot complete the orgasmic act, because they don't feel like they can trust anybody.
Because they're not safe. They can't give up that vigilance and control, that external awareness of danger. I mean, one way they can do it is they can dissociate. They just go away somewhere, kind of like multiple personality disorder. They just shift. Lights are on, nobody's home. Then their bodies may have orgasms, but they're not really having it. Their bodies are having it. If they don't dissociate and go away somewhere, they remain hypervigilant to the point that they can't cross that barrier. I mean, it's a conversation for another day.
Right.
But there are societal reasons, there are religious, moral, shame-based, guilt-based, depending on the lessons you've heard at home, histories of abuse, general stress and pressure. Some women are so stressed by the multiple layers of responsibility that they have for taking care of children and the household and the husband and the shopping and they just can't turn their mind off and have that experience. You have to be present for it.
You also have lots of roles. I mean, as a woman, I have to think, oh, well, I'm going to the office, I'm the doctor, then I'm going home, I'm the mother, then, you know, and then, oh, all of a sudden I'm switched off, I'm supposed to be the sexual woman that my husband married.
And you have problems with that?
Yeah. Yeah, I knew you wouldn't get that one. You guys get to be the same all the time.
That's right.
You're just
That's why
always
this is dinner ready.
Sexual beings.
Yeah.
But we have these roles, and we feel like some of the roles preclude our sexuality, like being a mother. I see a lot of my patients come in for treatment of their inability to orgasm anymore. They were orgasmic, they're no longer, and they wait till their children are out of the house because then they don't feel like mothers all the time 24/7 anymore, because mothers aren't supposed to be sexual.
Well, if they know the kids are out of the house, they don't have to listen for the kid to cough or to make noise or to come in at their inopportune moment. Because men don't pay a lot of attention to that, but women do.
Right, yeah.
I mean,
Men
historically,
don't really care, and that's part of, women are you know, even when we're not fertile anymore, women are still protecting the possibility of conceiving, so women are a lot more aware of what's going on, because what if they conceive with the wrong person? What if they, you know, I'm thinking about cave women. We still have that same set of wirings that make us much more aware of things going around about us, and men become very focused, and that's all they're interested in, and that's it, honey. So that's the difference. And men don't have those role shifts. Men are men are men. Women are mom, you know, they don't have a conflict between sexual and saying sexual jokes or joking around in front of kids. They're like, I'm the dad, I can do that. You know, they figure the kids won't get it, and they usually don't. So it ends up being that women won't do that in general. Women are very conservative about the children believing
but that varies from
the
culture to culture.
Yeah, well, we're talking about the U.S.
Yeah.
Right
yes,
now.
we are.
And those are the only people I really know personally, and those are the people, well, I have people from all over the world come in, but they're in general have the same
cultural background, right,
as Americans.
So obviously, things sexual, things orgasmic, very complicated, multifaceted conversations. If there are questions that you might have about things sexual or things orgasmic, you can always contact us with those questions, and we'll try to respond to them.
At podcast@biobalancehealth.com, or you can go to our website and read about some of these things and read about some of our other television appearances at biobalancehealth.com, or you can call my office at 314-993-0963.
And you can always reach me at brettnewcomb.com.